I've said it many times, I know I would change my ways, I know for sure. When all the crows decide to meet, they settle down beneath my feet. As I serve my brew, I'm cool with the work I do. Classics in the world.
Oh, good morning. Good morning. If you don't mind, sit down. So your name is Almaidah Firdaus-Tawamala, right? Yes, of course. Okay, I'm Hallie Stanford, the head of nursing in this hospital. Okay, nice to meet you. Nice to meet you too. How are you this morning, Alma? I'm fine. How about you? I'm fine too. Are you prepared for the employee interview today? Yes, of course. As a pediatric nurse? Yes, of course. Okay, first of all, please tell me about yourself. Okay, my name is Almaidah Firdaus-Tawamala. I am 24 years old. I have completed my education with bachelor degree in nursing program from Tasikmalaya Health Polytechnic of Ministry of Health in 2018 and University of California in Pediatric Nursing Program in 2022. I received my certification as a pediatric nurse in 2023 and passed in 2024. I am scholarship recipient from LPDP and I have been working in Manchester Hospital as pediatric nurse for the past 4 years and I have experience working in NICU, PICU and maternity unit. Additionally, I possess excellent communication skill, effective time management, and I'm also comfortable working with all ages, always energetic and flexible. Besides, I usually use a creative approach to solve problems. For example, I had a 2-year-old patient under my care who was treated for diarrhea. I teach parents to make natural oral rather than giving chemical drug because it's not good for the baby. Okay, and then what is your greatest skill as a pediatric nurse position? Okay, thank you for your question. I think that my greatest strength as a pediatric nurse is my ability to really listen to what a child is telling me. I'm very empathic and able to treat them as a friend. I'm very proud to my ability to emergency care for children and neonatal resuscitation because I have experience working in NICU and PICU. For example, I had a premature patient under my care. When I checked the baby, apparently the baby apnea. As a first aid, I did resuscitation. The baby finally survived and breathed normally again. Because if it's too late, the baby can be helped. Okay, and why do you want to work in Children's Hospital and Medical Omaha? Okay, I'm fascinated by the work culture in your hospital, and I like it because this hospital are really focused on the field of pediatric care. Facilities at your hospital very helpful to provide professional services. Your hospital has been ranked in the top 3 hospitals in US for the past 7 years. And your hospital always have new innovation and your hospital has received many awards. For example, Best Children's Hospital in Cardiology, Heart Surgery, GI Surgery, Orthopedic, and Pulmonology. I'm excited by the possibility of being a part and learning for your expert. Besides that, I had a good experience when I gave birth in this hospital because of the services and facilities are really good and I'm very interested working in this hospital. Okay, are you comfortable to working with other doctors and nurses? I would say I'm a good team player because I possess excellent communication skill, which help me to effectively interact with other health team members. During working at Manchester Hospital as a pediatric nurse in the PQ, I learned how important it is to communicate well with other nurses. One great example that every day we share duty based on room and patient. We also make sure that we work well with doctor, pharmacist, and nutritionist. And if one of us does something wrong or have miscommunication, we will talk about it later on to work it out. For me, this is challenging things because we turn a difficult situation into opportunity to grow. Okay, let me know what method would you use to help ensure a patient who was afraid of injection and anxious and how you handle that. Okay, thank you for your question. I have often faced difficult patients, handling them as a part of the job. While working overnight as a pediatric nurse, I had 5 years old patient under my care who was treated for diarrhea. When I was going to give an injection, the boy met rejection by crying, kicking, throwing things around him. Even when he saw a nurse or doctor wearing white uniform, he was terrified. I tried to invite him to play and tell story about elephant expenditure because he likes elephant. When I was about to do an injection, I invite him to role play. Therefore, he was not afraid and felt calmer when I give the injection. The most important question as a pediatric nurse, how would you resolve a conflict with parents of patient? Okay, thank you for your question. I would try to understand the parents' viewpoint. For example, I had 7 months old patient. After I give vaccine injection, the baby had a fever and parents complain with me. So first, I will pick the right time and listen all complaint of the parents and make sure they are calm. After that, I will explain the procedure because fever with most vaccine begin within 12 hours and last 2 to 3 days. This is normal, harmless, and helpful. After that, the parents understand and the problem is solved. That's good answer. What should we hear you as a pediatric nurse position? Thank you for your question. I have been pediatric nurse for the past 4 years and I have been professional experience in neonatal intensive care unit, maternity unit, pediatric care unit with extensive knowledge of health care services. I'm very proud that my comfortable working with all ages who have effective time management and good communication skill. I believe my background will allow me to give great services to Children's Hospital and Medical Center Omaha. I would be honored and excited to be a part of your team and contribute my skill to your staff and patient. I believe that I can bring many years experience and excellent attitude for your hospital. I will be valuable asset to any unit here. Let me know, why did you decide on career as a pediatric nurse position? Okay, thank you for your question. I was inspired to build my career in nursing because that is my mother's dream. And in 2017, my mother was sick and it made me to go hospital every day. While in the hospital every day was both inspiring to motivating to me because I saw hard work of nurse in caring my mother. I also want to make my mother's dream come true, so I decided to have career as a pediatric nurse. And then I want to do challenging things. This is also contribute to my interest in nursing as a career. Besides, I love working with children. They are so fun. They are so motivate me to be a better person every day. Other than that, helping children and their family is the most rewarding job I can think of. You know, nursing can be one of the most stressful occupation due its hectic and fast-paced environment. So, how you handle the stress of the job? Yeah, yes. Okay, I know how stressed this job is. However, I find the best way to handle the stress. It is through making a priority list of what need to get done throughout my day. This makes it possible for me to stay calm and focused. Dealing with stress is one of the most important part of being a nurse. I also make time during the years to do mountain climbing, and I try to respect my free time by not taking my homework with me. I also volunteer for a cancer house at California. I find these two hobbies effectively to relieve my stress. Okay, and this last question. What do you find the hardest part about being a nurse? Okay, for me, the hardest thing about nursing is losing patients. I have experience in treating children with leukemia. He was very close to nurses and doctor because he did routine checkup at the hospital. But after struggling for 1 year, he passed away. Knowing there's nothing we can do to help is the most difficult thing I deal with. This is something that is difficult to deal with, especially when it's unexpected. But I try to get through it by telling myself that I'm still made different, and this my the time when the hospital I did my best for them. I'm a nurse because I genuinely care about people and want to help them. Well, it's extraordinary time to help interview with you. I thought you extraordinary possibility to top up the position. I will call you later, and don't forget to look announcement in the hospital website. Okay, thank you and good luck. Thank you. Yeah. Okay, thank you, Miss Hailey Stanford. Nice to meet you. Thank you. Thank you so much. Yeah, thank you so much.